Mhm.
So why would someone see a physiotherapist versus a chiropractor?
Well, that is a complicated question, and I think what you have to it's in part what the person is looking for, in part what their concern is, and then I find it always comes down to just kind of finding the right practitioner for you. Because the reality is, like the old school way, Sandra was saying this a minute ago, the old school answer would have been something like, well, if you have something going on with, like, say, your lower back or your neck, that's where chiropractors tended to specialize. And if it was somewhere else, like if it was a knee injury or an ankle injury or an elbow or wrist, that might be more for physiotherapy. Or if you're doing like maybe either pre or post surgery, physiotherapy was usually your go-to for that. But the reality is, over the last decade or two, the lines have really blurred between what chiropractors will look at and address and what physiotherapists will look at and address. And there's a lot of overlap, so it can be confusing. So why do I say then that you want to try to choose the right practitioner? Because within both the professions, different practitioners will kind of treat differently. That seems strange to say, but what I mean by that is some chiropractors follow, as an example, a wellness model, where their entire practice has been built on and just drives the idea that by going to see them on a regular, semi-regular basis, that this has positive outcomes on your overall health. They call it a subluxation model or a wellness model, and if that's what you're looking for, like if you're looking for just some type of interaction where it's part of your wellness routine, then that might be the right practitioner for you. If, however, you're more driven by a specific outcome from an injury, right? Like you've developed lower back pain, or you're getting these headaches, following a car accident, for example, or whatnot. Then you might want to try. Then you're probably going to be aligned with finding a practitioner that is more driven towards, for lack of a better term, I'll say like a rehabilitation protocol.
I agree. I was going to say more of a rehab protocol where you're looking at specific exercises to correct imbalances and restore that specific injury as opposed to a wellness model.
Yeah. So I don't know much about wellness model in the physiotherapy world. I don't know if physiotherapists ever really adopted that style of approach. Certainly I know chiropractors have. And so within the chiropractic camp, there's a division of two. There's more the holistic wellness approach, and then there's more what we used to call, I don't know if we still do, but it's called mechanistic. It's more very much in line with a physiotherapist. And that's where you're going to find the overlap between a mechanistic chiropractor and then like what I would call like your rehabilitation physiotherapist. So they're both probably going to use, to some varying degree, some type of hands-on therapy to help deal with soft tissue components to an injury. They might do mobilization or manipulation of joints to try to restore proper movement back into it if there's some restriction, like if you're not able to access full range of motion, or at least pain-free full range of motion. They'll teach stretches. They may have some type of facility in their clinic for rehabilitation exercises. Those physios may or may not use modalities like acupuncture, well, chiropractors as well, acupuncture, or, things that used to be popular were like ART or gua sha, or these are different named techniques that basically are just soft tissue in nature, like muscle stripping or releasing trigger points or whatnot, breaking down myofascial adhesions, if that's still a thing. Yeah. And then, those physiotherapists typically are a little bit more hands-on, but they may still find room in their practice for things like ultrasound or IFC. But the important thing is, between those two practitioners, basically it starts with, it always comes down to the basics, right? They're going to do a history, they're going to come up with an analysis or diagnosis of what's going on with you, basically what's causing your pain. And then they should be putting forth a plan of action or a plan of management, a roadmap really to get you from the pain state to a pain-free state and then graduation from the practice. The wellness model encourages people to basically become long-term or lifetime members, right? Because again, the idea there is that the intervention that, I'll just go back to the chiropractor is using for you, usually through spinal manipulation exclusively. They don't typically, they may do a little bit of soft tissue work, but the driving piece of their therapeutic intervention with you is through spinal manipulation. And it's usually whole spine, like they usually kind of go top to bottom to try to get everything that they've analyzed or whatnot. Those practitioners are looking for a long-time membership because again, their approach is more from the standpoint of getting your spine adjusted on a regular basis has important metrics on your overall health. In other words, you're going to feel better, which can translate to, you know, maybe you do better at perform better in life. You know, there's a psychological component to it where you get adjusted, like, oh, I just feel better kind of thing. There's a lot of potential avenues or aspects of that they espouse that has a positive impact on your health. So this kind of goes back to what are you looking for in your practitioner and what do you need to get out of it?
Also, like if we go way back, I've been practicing now for 23 years, and if I go back to when I did my training, it was almost as though we were taught that physios and chiropractors cannot work together. And when I graduated, that was sort of my mentality. And I feel like over the course of my career, what we've actually found is that a lot of people do really well working with both practitioners. I think that not only do you have to find the right practitioner that has the right tools for each patient. If I take myself as an example, the times that I've had injuries or low back pain, whether it be from overuse or from my profession, or I've had both chiropractic care and I've had physio. I think it's really important for the practitioner to be able to differentiate what they feel is the underlying issue and who they will benefit more from. So myself, I'm extremely flexible, I'm hypermobile. So for me, I need to strengthen my muscles and create more tension in the system. So going in and getting manipulated or adjusted, if I'm seeing a chiropractor, not doing any of that muscle component, did not give me any relief.
Yeah.
It was very short term.
Yeah.
Okay? So for my rehab, what I really needed was to strengthen and create more stiffness in certain segments. Yep. So again, I'm a huge supporter and believer of Chiro, and I try and, when I'm treating somebody, look at which way does this client tend to be. Are they more hypermobile and they need more strengthening and exercising, or are they super stiff and they need mobility and stretching? So that's what I look at, and in terms of who is a better fit for them.
Yeah.
You know?
Well, 100%. Like that comes down to your analysis.
You have quite a stiff spine, right?
Yeah.
Overall, I feel like you would, if we compared my needs versus your needs, I would say you are somebody that would benefit more from regular adjustments because you have a lot of stiffness in certain segments of your spine.
Yeah.
Sorry if I'm sharing too much with everybody, but so a lot of my clients, so like if I'm progressing through our treatment and they're now out of pain and they're moving better, and I get to a point where I feel like they're plateaued, and I was like, well, I really feel like they could use some spinal manipulation on certain segments, which is not something that I personally practice. I feel like, again, we can work together really well. So, and I think so. Everybody benefits from a combination of both. It's not that we can't co-treat, and in a lot of clinics now you'll see that, like here at CBE, we have both practitioners that people can benefit from.
Yeah, yeah. No, I think that's right. Like, it comes back to when like you have pain somewhere, right? But there's different explanations as to why you may be experiencing that pain. You might be too stiff, you might have an imbalance, you might have a tear, you might be too lax or whatnot. So finding, I find it all starts with getting an idea as to what's going on, a plan of management or an action plan, and then moving forward. And then that can adjust over time, right? Like if you find that this isn't working out, or we're not getting to where I thought we were going to get in the amount of time I would expected, you go back to the drawing board and reevaluate. And actually, I find myself personally, that's where having physiotherapy colleagues, or physiotherapist colleagues is really helpful, because even though there's a lot of similarities, we might look at things or think of things a little bit differently.
Yeah.
And you know, by making that referral, and they go, oh, well, this is what I found on my assessment. You go, oh, I hadn't considered that, and then that can lead to more positive outcomes for the patient. So it doesn't really tell you who to go to first, but it's nice knowing that they're there for like that second opinion as well, because whatnot.
If I could use an analogy, I'd say it's like we speak the same language with slightly different dialects. Does that make sense?
Yeah,
You know?
no, that makes sense.
Yeah, and
That
it's
makes
really
sense.
helpful to bounce ideas off each other. But really, there's no perfect answer to this. You know, who would benefit?
No, and
You know.
you know, some people, I've spoken to people, and they've said to me, Damien, I know that if I just did X, Y, Z, my back pain would go away, but it's easier to go see my chiropractor once a week, and it goes away for the week, and then I continue on with life. Okay, like there's nothing wrong with that. You know, some people are super afraid of getting their spine adjusted because they've heard of things, you know, how they've heard of things on the news or whatnot, or they've met people who had a negative experience with it, and that's okay too. Like, we don't just have to adjust people.
I think also in terms of you, during your initial assessment, where you ask patients what sort of, what are you able to commit? Because there's our part
Yep.
of the relationship, and then there's their part. And some people straight up say, like, look, I'm not going to spend a lot of time doing exercises and stretches. I want to come in here every week or twice a month and get adjusted, and I feel pretty good, and I don't have any other issues as long as I'm coming in doing that.
Yep.
Again, like knowing yourself, you know? So whereas somebody who's like, no, I really want to, whatever, get stronger, I go to the gym 3 times a week, I want some extra stuff to work on outside
Yep.
of sessions. Not that chiros also can't do that, but I tend to be, I mean, I'm not a big fan of modalities, like, you know, other than acupuncture and soft tissue release. Like, I believe that everybody that I'm treating has a home exercise program, and they have a role as well in their healing.
Yep.
Right? So I can only do so much. We're working on correcting imbalances and having them move better overall, but there's a strength component to everything. So I think it's also knowing yourself and being honest with yourself. Or maybe you'll have times in your life where you're super busy, you've got a job that you have to put in 50 hours a week, you've got young kids, and you're like, hey, this keeps me pretty good, I'm gonna come in and get my adjustments, eat in and out, and I don't have time to do much more, then maybe Chiro could be a better fit. And maybe if there's times that you want to focus a bit more on the fitness, strength portion, then physio could be a better fit. That's sort of also there's a lot of, I don't know. Maybe we just take that segment out, because I'm not really sure where I'm going with it.
So in summary, I think the choice of going to a physio or chiropractor starts with what the patient or the person watching this is looking for. Are you looking more for a holistic wellness approach, because there are chiropractors that will offer those types of services? Are you looking more for an injury rehab approach? There are chiropractors that offer those types of services, as well as, I would say that's a large part of physiotherapy. Everything starts with a plan of action in the rehab world, especially, but also in the wellness world, where basically a diagnosis is derived or an impression of what's going on, to create some type of a program for you, a treatment plan to get you to where you need to be. The treatment plans are never, they're always fluid. They move around. And just, just make sure that, whichever way you go, that in terms of, that it's meeting your needs, and that you're able to work with this individual, that you feel comfortable with them, that you feel safe with them, and that you're seeing the results that you want to see, and you're not just going along for the ride hoping that something will get better at some point.
That's the bottom line. There should be some sort of progressive improvement, even if it's you feel like you're 5% better per month. There should be some sort of improvement. And that's also sometimes where I'll decide to bring in another practitioner, recommend Chiro or somebody else if I feel like we've hit a plateau. And I was like, okay, well, let's try, we'll take a break for a little bit. I'd like you to go see Chiro for 5 or 6 sessions and then come back and we'll reevaluate. That also works quite well at times, right? So it's a fluid process.
Yeah. Anyway, guys, thanks for watching. Sorry if I went off topic a little bit, but we'll see you next time. Take care for now.